Hello, everyone. Welcome to chapter number 6, the substance abuse. In this chapter, we will understand about the underlying causes of addiction, psychological dependence, physical dependence, classic and conditioned withdrawals, significance of the drug tolerance to the pharmacotherapy, and we will explain the major characteristics of the abuse, dependence, tolerance resulting from the following substances like for alcohol, nicotine, marijuana, hallucinogens, CNS stimulants, sedatives, and opioids. We'll provide the reasons for the healthcare providers developing the problems with alcohol or substance abuse. We'll identify the signs of the substance abuse exhibited by the healthcare providers. And we will describe the methadone maintenance program, what it is, and its role in Canada. So first is the substance abuse. It is the self-administration of a drug in a way that the society views as abnormal and is not acceptable. And it has tremendous economic, social, and public health impacts on the society. So we're going to be learning about that abused substances. They belong to many different chemical classes. A wide variety of classes are abused, all affect the nervous system because it is a game of a brain. So natural sources from where the drugs are originated, which becomes these drug abused, they are the opium, marijuana, cocaine, nicotine, caffeine, and alcohol. These are the natural sources from where the abused things are formed. There are some synthetic, which are called as designered, and they are illegally made into the laboratories. Then there are some legal drugs, they are abused as well. Alcohol, it is legal for the sale in Canada and it is for abuse. Nicotine, Ritalin, and Demerol. These are the names of the drugs, and these are legally drugs or things in the market, and they're abused. Now, some people, they can use the household substances as in substance abuse, which are aerosols, paint, thinners, and the glue. Now, commonly abused substances, the legal substances without prescription that we get it outside in the market, and they are cause the substance abuse is number one is ethyl alcohol, which is called as a drinking alcohol, and it is the over-the-counter. You can get it from everywhere. Methanol. Methanol, we don't need a prescription. It is used as a solvent or the varnish, but it is also used for substance abuse. Either it caused the blindness, but people still use it. Caffeine is present in coffee, OTC drink. If we take 1 cup of a coffee a day, that is not kind of a substance abuse too much. But if some people, they are like abused to having 5 or 7 coffees in a day, their day starts with coffee, their day finishes with coffee. In the lunch, they need coffee. At supper time, they need coffee. So that is kind of a substance abuse. Even I would say, in my personal opinion, if you have to start your day with coffee, this is kind of an abuse. And if you don't take the coffee in the start of the day, you get a headache. So it means you are already abused for the caffeine. Next is nicotine, is tobacco, the same thing, but we use the medications to stop them. It's for some smoking cessation patches, some medications, some inhalers are available. Now, there are some drugs which are under the substance abuse, and they are the legal substances given by the prescription. For the CNS depressant, depressant drugs, we use the sedatives, and these are the barbiturates. And then is the benzodiazepines. We need to give to the patient as in CNS depressant for sedation for so many reasons, might be because of injury or pain, but it becomes the commonly abused substance. Opioids like codeine, we have to give to the patient for the pain therapy, but it gets abused by the patient. Ketamine is an anesthetic. Gamma hydroxybutyrate is an anesthetic. Amphetamines, methamphetamines, and methylphenidate, which is called as Ritalin, they all are CNS stimulants, but yes, they can be used as a substance abuse. Anabolic steroids for the weight gain, the medication that we use, which includes the testosterone, progesterone, and estrogens. So they can also be legally prescribed and can be commonly used as a abused substance. Now, illegal substances are discontinued in the traditional therapies as the opioids. The natural source was opium, and we give them is the heroin. Cannabinoids, it's THC. It's a complete name that is written as THC. The natural substance is marijuana. It is obtained from marijuana. And medication, as a medication, it is used for glaucoma therapy. Lysergic acid diethylamide, LSD, it is obtained from the rye or the grain fungus, which is a prescribed medication for the psychiatric therapy. Next is psilocybin, is obtained from mushrooms. Mescaline is obtained from the peyote. Phencyclidine, it's the PCP, which is an anesthetic drug. Now, there are some other drugs, they are illegal substances, they're discontinued in the traditional therapies already. It's the methylene dioxyamphetamine, MDA. It was a designer drug, means it was synthetically made in the laboratory, but it has no medicinal use. 3-methoxy MDA, ecstasy, designer drug, no medicinal use. 2,5-dimethoxy 4-methylamphetamine, STP, serenity, tranquility, peace. They are all the designer drugs, synthetic drugs, and no medicinal use. You don't have to remember these names, but you have to be very careful with these names. Yes. Next is cocaine, that is obtained from a coca plant, and it is used as a local anesthetic. Next comes to the addiction, depends on multiple, complex, and interacting variables. Addiction is progressive. Everybody knows that. Let's say you are taking 200 milligrams of a dose for one substance. Your body gets used to of that for after a couple weeks or months. Then if you take 200, your body is not showing the effect. Then you have to go for 250. Then for 300, then 350. So that's how it is progressing. And the chronic use of the substance is really going to be addiction. Now, there are variables to the addictions. What are the agents? What are the drugs of abuse? What are the factors? And what is the environment that is affecting the addiction? Next is substance dependence. When I say dependence, like our body needs a coffee every day in the morning, right? Or tea every day in the morning. They have an amount of caffeine in them. So our body is already dependent on the tea or the coffee for the caffeine. So this is called as a physical dependence or the psychological dependence. If we don't drink tea or coffee in the morning and we start our day, we think, oh no, I'm having a headache. I'm not feeling well. I think I really need a tea because I haven't taken my morning tea. That is actually a physical dependence. That's what with the people who are drug abused, they are abused with their drugs. If they don't take it, then they feel annoyed, irritated, just like we get irritated if we don't get the stuff that we want to take. Now, physical dependence is an altered physical condition. It is caused by the nervous system and adapting to substance. Body is tricked into thinking altered state is normal, and withdrawal symptoms occur when stopped. A simple withdrawal symptom, I'm telling you, if you don't take coffee, you're addicted to coffee, then you start getting headaches. That is a withdrawal symptom. So with the major drugs, with the big drugs, if you stop taking those drugs, definitely they will be showing the withdrawal symptoms as well. So some dependence can occur quickly, like with opioids, such as morphine or heroin. That's why most of the drugs are here. They are the refined form of the morphine as the hydromorphone. And the people usually get used to of that because it's used as a pain therapy. And when people use the hydromorphone, they feel like, oh, my pain is gone. Why should take the pain if I can be away from the pain with hydromorphone? So they start taking it. So slowly and slowly they get abused to of that. That is a physical dependence. Next is psychological dependence. No signs of physical discomfort when stopped. But your brain is saying now, your brain is scared. No. I have to take my medication. If I don't take it, I will be in pain. And if I will be in pain, that will be unbearable for me. I won't be able to work. I won't be able to do my everyday things. So that is kind of, you have feed your brain with the things that you are psychologically dependent on that. Next is overwhelming desire to continue to use despite obvious negative consequences. You're often responsible for the relapse. And it is usually a dependence requires relatively high doses over a long time, and the cocaine being the exception. Cocaine is one of the exceptions from that. Next is withdrawal results when an abused substance is not longer available to the body. Now, withdrawal symptoms may be severe, I was telling you. It is best done in the facility with support. Other drugs are often used to assist with symptoms. And alcohol withdrawal can be treated with diazepam, group treatment help, that is AA, which is one of the group treatment. Now here is the withdrawal symptoms of selected drugs of abuse. So we need to remember that. I know we can't remember all, but try to remember most are like relevant to each other. For example, if we withdraw taking the alcohol, so the human or the people, they are just taking the withdrawal symptoms of the alcohol, they will feel like tremors, fatigue, anxiety, abdominal cramping, hallucinations, confusions, seizures, and delirium. If they stop taking barbiturates and other sedative hypnotics, they will be showing insomnia, no sleep, anxiety, weakness, again, abdominal cramps, tremor, anorexia, seizures, hallucinations, and delirium. Benzodiazepines, this similarly is insomnia, restlessness, abdominal pain, nausea, sensitivity to the light and sound, headache, fatigue, and muscle twitches. Cocaine and amphetamines, mental depression, anxiety, extreme fatigue, and hunger. Hallucinations is rarely observed, dependent on the specific drug. Marijuana, it's irritability, restlessness, insomnia, tremors, chills, weight loss. Nicotine, irritability, anxiety, restlessness, headaches, increased appetite, insomnia is again inability to concentrate, decreased heart rate, and the blood pressure. Last but not the least is opioids, excessive sweating, restlessness, dilated pupils, agitation, goosebumps, tremor, violent yawning, increased heart rate and blood pressure, nausea, vomiting, abdominal cramps and pain, muscle spasms with the kicking movements, and weight loss. If you see, they all are closely related. So how you can remember them? Most of them, they have the tremors, fatigue, anxiety, insomnia. So just mark out them. These are the common symptoms as withdrawal symptoms. And then remember one or two special symptoms, like in benzodiazepines, the muscle twitches. In cocaine is hunger, right? In nicotine, it's increased appetite, decreased heart rate, decreased blood pressure. So point out some, those are similar with others, and some, those are special to the particular drug. This is how you can remember them. Next is tolerance occurs when higher and higher doses of the drugs are needed to achieve the initial response. Now that was, I was giving you example. First day you were dependent for 200, then 250, then 300, 350, 400. So your body is getting tolerated to the drug that you are giving it every day. So it's a biological condition when the body adapts to the substance. Higher doses are needed to produce the effect and different rates for the different drugs. So tolerance to one drug may cause tolerance to similar substances as well, cross tolerance. Heroin addicts can develop the tolerance to the opioid narcotics. So now if you give them opioid, there is no use of that drug to your body. Next is central nervous system. Depressants decrease the activity of the CNS. Absolutely. If they're saying depressants, they are decreasing. So those are one of these sedatives, which decreases the activity of the brain. They're also called as tranquilizers. They're prescribed mostly for sleep and some epilepsy. So if a patient says, go to the doctor and says, I am having a sleep disturbance, and now that sleep disturbance is not, might be because of substance abuse, might be because of the withdrawal, or might be because of the everyday stress life, you can't just sleep. So the doctor prescribes you tranquilizers. And for epilepsy, they want you to sleep, so they prescribe you tranquilizers. But on the other way, those tranquilizers will be tolerated by your body, and then it will become an abused substance for you. So there are two classes: barbiturates, non-barbiturates, sedative hypnotics. they are used for the longer duration of action. They give you, if you take one sedative for one night for sleep, it doesn't mean that one tablet will give you the tolerance, dependence, or abused. If you're taking for a long duration of time, let's say 6 months, a year, 5 years, 10 years, now you're used to of that. Your body is used to of that drug. And if you will take the overdose, it's very dangerous. And in every day in the world, the people are dying of the overdose of these sedatives that are the sleeping pills. Withdrawals are similar to the alcohol, as we have already discussed for the barbiturates. What would be the withdrawal symptoms? Next is benzodiazepines. So this is another class for the CNS depressants in which we include all the PAMs. Lorazepam, oxazepam, clonazepam, flurazepam, all comes under the benzodiazepines. They are widely prescribed in the whole Canada. The uses are, it is given for anxiety, for seizures, and as a muscle relaxants as well. But abuse is not common for the drug. This drug is not commonly abused. People take it, let's say they need a muscle relaxant, they take it, but they're not getting abused of it. Because muscle relaxant they're taking, it's not gonna be for like 6 months or 1 year. But they're often combined by the abusers with alcohol to increase the effect, to potentiate the effect that they want to feel for the substance abuse. Next is opioids like hydromorphone or the codeine stuff. It is used for the severe pain, for the persistent cough as well, and for the diarrhea. So if a patient comes with a prescription of cotridine, it's a liquid, it doesn't mean that he is in a substance abuse patient. We also prescribe the cotridine or opioids or codeine for the kids as well in a smaller dose if they are having a persistent cough or if their diarrhea is not getting stopped. Because opioid has the side effect of causing the constipation. So because of this side effect, we start using it as an antidiarrheal. Now, if we take, the effect begins within 30 minutes orally. Anybody who takes that opioids, they have to wait for 30 minutes to show its effect. What happened? Otherwise, they have the side effects. When you take this drug, the pupils gets constricted. In everyday, increased pain tolerance and the respiratory depression occurs. So it is very, very important to take care of these drugs when we have to prescribe them. That's why there are the triplicate prescription program is made to prescribe these kinds of opioids. So there should not be any error to be done for the patients. Addiction occurs very rapidly of that. So we have to be very, very careful about the dosing. Intense, very intense and unpleasant withdrawal symptoms occurs. So try to avoid these kinds of medications if we need it. But if we can't avoid it, so we have to be watch on, so we should not get under the substance abuse for this drug. Next is ethyl alcohol, is a liquor that is on sale in the market everywhere. So it's the most widely abused drug. Economic, social, health consequences of abuse are very high. Legal substance, it's easily accessible. Anybody can go and buy the alcohol. So it's a CNS depressant. All people in the world, they feel they're under stress or they're enjoying the life by using this kind of a drug, but they don't know that they get abused of it. But it shows it affects depending from the concentration that we are taking from 5 minutes to 30 minutes. Alcohol intoxication, muscle coordination completely lost when you are under this, and mental function is affected as well. This causes physical as well as psychological addiction, and the liver is the organ which is mostly affected by that. Withdrawal is very severe. If you take it back, it's gonna go you insomnia, fatigue, deliriums. You are not feeling annoyed, you're feeling annoyed the whole day. People try to mix it with the energy drinks, and it has led to the symptoms of cardiac irregularities and neurological effects. So it is already one kind of a drug addiction. And if we use them in the energy drinks, it's lots of things in them. So they causes a food-drug interaction, and then they causes the cardiac irregularities and neurological effects. Now, when we talk about the treatment for the addiction, it's very long-term addiction, long-term treatment. It's not going to be working for like in 1 month or 2 months. There are 12 steps that we have to follow under the program, which is called as AA. And it can also cause the lifelong illness even. And abuse can be used to discourage the relapse. And abuse. We don't say that this drug is abused, because if we're going to be saying them for stopping this abuse, it's going to discourage the relapse. And if alcohol is consumed, the person becomes violently ill within 5 to 10 days. So we have to be following a very good plan to getting the people out of the alcohol. This one is concept 6.7. We will do in the next video. Thank you.